Hi, I'm Alex Howard, and I'm here with Tanya, Page Nutrition at the Oxford Health Clinic. Hi Tanya.
Hi.
And this is the 6th video in our series of videos around some of the reasons why people have reactions to supplements. And it's part 2, talking about detoxification. So in the first video on detoxification, we talked about liver congestion, and in this video, we're talking about lymph congestion. So maybe a good starting point is what the lymph system actually is, and then what lymph congestion is as well.
Okay, so the lymph system is part of the immune system. It's a series of vessels and capillaries that goes throughout the body, along which there are lymph nodes. We all know about the ones in the neck. There's a number of them all over the body. So if your glands come up, that's your lymph nodes. The job of the lymph system is to drain fluid out of the cells along with toxic products or waste products from the cells, to move them back through the body into the bloodstream and then back to the liver to be detoxified out of the system. So by lymph congestion, what we mean is that something is stopping that movement happening. And there are 3 main reasons why that would happen. So one classic one is that if there's been a history of chronic constipation, then waste products won't ultimately get out of the body properly or efficiently. That tends to back up to the liver, and then the liver, of course, backs up into the lymph system. So the stuff coming out of the cells just has nowhere to go, and the whole lymph system gets quite congested. Another reason is that there is actually a structural block somewhere. So if someone has a structural issue that needs sorting out by a physio or a chiropractor or osteopath, then that can actually create a blockage in the lymph system. That may actually be solvable by massage, lymphatic drainage massage or something along those lines. One of the ways you might realise that you have a lymphatic problem is that massage actually makes you feel worse because it gets everything moving. Yeah. Okay. But ultimately, if there is a blockage, it needs to be unblocked physically.
Although perhaps, but not done too much at one time.
Absolutely.
Because some practitioners will just go in and just kind of launch into it.
Yeah.
So it's been in a manageable kind of way.
Absolutely.
And the third reason?
The third reason is that simply because the lymph system doesn't have a pump, the fluid is moved along the lymph system by small contractions, but mainly by the movement of the person. So if you're not able to walk and get around, it's a problem. One of the ways of getting the lymph system moving that's quite well known, I think, is to use a rebounder. And the jumping up and down on the trampoline will actually, efficiently get the lymph system moving very well. However, of course, many of our patients, that would be the last thing on their mind, or within their capabilities. So in that situation, we might suggest that if massage or other sort of physical treatment isn't possible, maybe just to get someone in the home or a friend to actually help that person move, moving the arms up and down, moving the legs forward and back, just to start a movement in the body. Yeah.
Okay. So what would be some of the symptoms that someone had lymphatic congestion? I mean, you mentioned, for example, the glands. So I guess.
Yeah. The classic one is the glands will come up whenever you try to do something that detoxifies, and your practitioner could obviously tell you what supplements you might be taking and what things you might be doing that would encourage detoxification. So whenever you do those things, if your glands come up, it's quite it's a good thing in some ways, because you know that the body is actually trying to detoxify because the glands are coming up and they're getting full of toxins. So it means that something's happening. So in that sense, it's a good thing. But if you can't get those toxins further out, then it's a problem. So you certainly would notice that you might get sort of dark circles under the eyes, that sort of thing. Often people would react to things like probiotics, vitamins and minerals, things like that. Those are the main symptoms. Okay,
great. And I guess you kind of already mentioned something we would do about this. So it's really a case of identifying what's causing the blockage, and then we can work with it.
Yeah, I mean, if it's a blockage, we need to do something physical. If it's lack of movement, again, physical. If it's there are some things we can do nutritionally in terms of giving supplements that enable the lymph to really clear a lot better.
Yeah.
It's really down to the situation for the person involved. If it's constipation, that's easy for us to sort.
Yeah.
So again, it's looking at the big picture. You wouldn't address lymph without addressing constipation on the liver, for instance. So you'd look at the whole pathway.
Yeah. Okay. Fantastic. Well, I think what we're kind of really saying is it's like a lot of these things, once you know what's going on, then you can do something about it. A lot of our expertise is by being able to identify what it is that's going on.
Absolutely.
So thank you for watching, and we look forward to talking with you again in another video, hopefully very soon.